What icks me, what triggers me is that men always expect we women to do family planning, and I feel like it has a lot of impact in our bodies.
Yes, it does.
Because one, we are expected to carry the pregnancy. When we face fertility issues, and you know these family planning methods always come with delayed fertility.
Yes, of course.
I don't know what. It's our fault. Na hata hiyo hormones.
Yeah.
Adding weight.
Losing.
Inakujanga na bleeding.
Yeah.
Hi, my name is Anne Maina.
And I'm Tama Mbugwa. And this is Even in Sickness.
Hello guys, welcome back to another episode of Even in Sickness. As usual, kabla tuanze, tafadhalini, kama uja subscribe.
Remember to subscribe.
Yes.
Share, like, comment, and hit the notification button.
Imagine the passion that we have, you guys. Imagine the passion. Amjai kuja mkakosa episode. Now, this is going to be our first episode whereby we are having a conversation, me and Tama. The others zenye mmekuwa mkiwatch, it was about interviewing people, basically, and telling their stories. We thought we should do something different, ndio pia isikue a bit monotonous, you know. People lose interest so fast.
A little bit of chit chat, enlightening you. Tusikue tunawapoteza
bana. So tafadhali, kama kuna rafiki yako alikuwa na watch episodes zetu za interviews na kaboeka, tell them to come back.
Rudy.
Yes.
Please.
We are going to have a conversation today about
medical myths.
Yeah,
lakini nyinyi mwezi kwa mnazijua kama medical myths. Wanaweza kuwa wanazijua kama vitu tunasemanga huko kwa kijiji, ama ulifanyikiwa hivi and then no, that is not supposed to be like that. You're not supposed to do this. But we call them medical myths.
Yeah, we do. There are so many things that go around, by the way. Unasikia, unajua, this happens because of this. We're going to talk about it, and we also want you to comment. Tell us the medical myths that we do not the medical myths, just the myths that we don't mention. You tell us on the comments.
Yes.
Tuambie what you've heard about them, ama what you believe, so that we can share.
Yes.
And then we'll be reviewing these comments in every episode.
Yeah, this is going to be a good one.
It is, by the way. Now, our episodes are going to be running every other Friday, 2 Fridays in a month. So kama last week tuli post, this week tunaruka, then we, cause hatuwezi manage ya weekly, we are busy people.
It is work. It is work, by the way.
It is.
We need content creators, by the way. We salute you.
Big up.
Yeah. So we go right in. Okay, so the most common one enye inakuanga a complaint ya wazazi wakileta mtoto hosi, amekuja na kahoma, ama wanasema amefungana nini, alafu anakuambia kuna hii kereme in Kikuyu, they call it kereme. Wanasema
it's UVULECTOMY, by the way. For the English people, it's UVULECTOMY. Watu wa Kiswahili sijui.
By the way,
there is something between your hard palate,
yes,
and the uko nyuma ya tongue hapo kuna hiyo kitu ina hang hapo, inaitwa uvula. Insert picture uvula, our videographer, insert uvula hapo.
Even the ones in the ward when you wamepata watoto like 2 days 1 day old, anasema unapata mzazi wake nao shosho amekuja amesema lazima tukate hiyo kitu kwa sababu ya infections. That is a lie, a very big lie.
It is by the way, and I actually saw a study that was done in Uganda. Sikupata ya Kenya, poleni. And it is done by traditional doctors by the way. Na wanasemanga that when you cut that thing, hiyo kitu homa hiyo ndio inaletanga homa. Now the truth is that thing gets the uvula, it gets infected. Yes, it does. But it does not necessarily increase the episodes za homa per se. And by the way, I'm not an ENT specialist, lakini sijawahi sikia scheduled for UVULECTOMY tomorrow.
It is totally not the cause of the infection anyway.
I used to, by the way, I used to practice vile tu nilimaliza shule nikitamak kidogo. I had a clinic in some rural part of Murang'a. So kuna mtu alikuwa kuna kijana mdogo alikuwa analetwa huko all the time, akona homa, amefungana nini. So the father was like, nataka nimpeleke akakatwe nini hiyo kereme. Nikamwambia
they have a traditional specialist wako.
They do actually. The research I found online, it explained how they do it. Yes, wow. They usually get a new blade, sijui what, and then you hold the baby, uneka kitu kama ile ya dental ya kufungua meno hivi, and then they just cut it. No anesthesia, no nothing.
Oh my god, that is a lot of pain.
I know. So alipeleka mtoto akakatwe hiyo kitu. So anyway, I waited nione kama homa zitaisha, but they didn't. Alirudi tu. Anyway, that is totally untrue. It is a medical myth. There's nothing like that. Tafadhali usipeleke mtoto wako akakatwe kirembe.
Yeah, why are you taking it out? See, like akopoa mtoto ako sawa. Infection definitely will happen kwa sababu ya the bacteria and the lifestyle we live na nini.
Usually commonly it's usually a viral infection by the way, unless ipate bacterial infection. But it's totally a myth. Yes.
Zile zenye we can say we now need to take them out ni tonsils.
Oh yeah.
See, lakini sio uvula.
But then tonsils unajua it comes with complications. Zinakujanga na something we call failure to thrive. Unapata mtoto haongezi kilo. Anyway, story for another day. Atuko kwa tonsils we are there.
Lakini the point has been made. Watu wachane na uvula wazazi.
Tell us what you've heard about kukatwa kirembe, that uvula thing, and how it is practiced in your
village.
Yes.
Or city. Wanaweza kuwa they have modernized their clinics.
All right. Sawa.
Yes.
What do I have next? Let me see. This one is an interesting one. I've heard about drinking early morning urine.
Wow.
Apparently it has a lot of, I don't know, electrolytes. I don't know what I heard, but it has, apparently mmoja alikuwa anasema sijui it has nutrients ama it's a lot of vitu unatoa kwa mwili and they are important. So they were advising people to drink that early morning urine. Very good for your body. Very good.
Come on, really?
Actually, I've had it 3 times.
Wow.
Yes. The first time, I had it with my mom. No, she's not the one who was saying it. It's a patient she was seeing. My mom is a physiotherapist.
Okay.
She does a lot of home-based care. Holla at me. She's almost retiring. She'll have a lot of free time. So there's this patient she was seeing. Yeye ndiye alimwambia ati anakunywanga hiyo mkojo ya asubuhi sana.
For how long has this person been taking the urine?
I don't know. That time I didn't ask because I think I was in medical school. So sikuwa na hiyo ujuzi mingi sana, but apparently that is the first time I had it. The second time I had it was with my patient. Alinipata tu kwa ofisi. And this is a patient who has kidney disease, by the way. Akona chronic kidney disease. Akaniambia ati kuna mali alienda akaambiwa na daktari.
Daktari.
Hiyo ni uongo. Lakini unajua in Kenya everyone is a doctor. You put on a lab coat,
wewe ni daktari.
You are a doctor.
Full stop.
Aki, I am going to diverge from this topic because hiyo place nilikuwa na practice Murang'a.
You are allowed to.
I had a rural clinic in Murang'a. So when I first went to, it was a village, sitasema jina, but I know some people know.
Usiwachome.
Naona tu mtu akicheka pale because he knows. So when I first went to that village, nilipata watu walikuwa wananiambia tunanunuanga dawa pale center, kuna kwanga na daktari anauzanga dawa. Okay. Pale center kuna daktari anauzanga dawa. So apparently mwenye alikuwa anauza dawa ni it's a mama amekaa duka and then ameka tu Panadol to Moxil and now they are calling her daktari. You know,
mama duka wewe.
Siji kama ni huyu daktari aliambia watu wakunywe mkojo, but anyway, so the patient was like, I was told to be taking it. And then she came in with a lot of complications, by the way, because first of all she has kidney disease, and now she's also taking the urine. You understand? First of all, she's on so many medications. Na unajua most medications are gotten rid
by the kidneys.
Yes,
excreted.
So the daughter, ni daughter wake alikuwa amemleta, ndio alikuwa ananiambia since she started taking the urine it's been bad. Amekuwa na edema ni swelling of the
feet.
Please medics, don't crucify me.
It
is swelling. Tasema swelling of the not of the feet only, but
any part of the body.
So alikuwa na swelling, amekuja na chest congestion, nini. Anyway, it was just a whole lot of
complaints.
I can't remember the third time where I had it from, but I can't remember.
Lakini that is gross.
I know.
Gross. Who does that?
I know. Urine by the has especially kwa watu wa kidney disease iko na just it has a lot of electrolytes, na those electrolytes kuzichukua tena kuzirudisha kwa mwili, it's
and
not
that was
good.
waste. The body didn't need that. That's why it was actually being taken out. So why would you take the jamani?
I don't know whether we are exaggerating this, lakini pia hiyo mtuambie kama mmewahi sikia hiyo tafadhalini.
But I think I've heard of it. I'm sure story watu wanajua.
Okay. All right.
Hebu you tell us hapo kwa comments.
Sawa.
Okay. Let me see. You thought yours was interesting. Hey, mine is interesting. Mine is about sex and pregnancy.
Okay.
Yeah. So also me, I have a backstory.
Tell us.
Okay, so this one time I'm in college. Tuko kwa hostels. Tushakula sapa, so tumerelax tu tunapiga story. So unajua kwa hostel, we did have a TV room, lakini hatukwanga tuna watch TV. It was just there. But sasa tuko kwa hostel tunapiga story. I'm like in the first year, and also I have a classmate who's also a roommate, and then there's another girl, but she's doing another course. So mi hata sijui story ilitoka wapi. Tumeanza tu kupiga story, and then what I remember is she says they say watu huku nje wanasema you should not practice sex during pregnancy.
Okay. Why? What were the reasons?
Mimi na ode mwenye tuko the same class tumeangalia na hivi no, we want to know why. Why what happens? Kwani what happens during when people practice? And then she was like, what happens when you do it, the cervix is opened. So we are risking expelling the baby. Which is not true.
Okay. Now let me contribute kidogo.
Yes.
For ladies who experience bleeding in pregnancy, usually we tell them to abstain from sex, because usually bleeding is usually a sign of of abortion.
Yeah.
We use the word abortion. Wacha tutumie miscarriage.
Abortion
but abortion is a medical term.
Yeah.
We call spontaneous abortion is allowed. Spontaneous abortion is what people call miscarriage.
Lakini huko nje tunajua abortion ni mambo wasichana wanafanya.
But all early pregnancy losses are called abortion.
Yeah.
And it's that's medically.
Yes.
So for females who experience bleeding, whether late or early, usually we tell them to avoid
Abstain.
sex.
Okay.
Totally because kuna vile kama if there is that sign of pregnancy loss, already bleeding is a sign of pregnancy loss. Sex inaweza fanya it secretes something we call, my god, tafadhali msini crucify medics, lakini nimesahau. So this thing,
we are actually not here for the medics anyway.
Yeah, we are here for fun. We are here for fun.
Yeah, and the rest of
So inafanya uterus contract. Yeah, that is it. So for ladies who experience bleeding in pregnancy and all that, obviously, but
in those case scenarios, that is when it is not safe.
But I think when you're pregnant, it's the best time to have sex. Because in this time you're not worried about I don't know, family planning.
Pregnant and
I don't know what, like
it even helps. It even helps when the mother is close to delivering. They say that is true. But when women come to the maternity, they say they've I've been active until the last time. Nisaidia sana.
All right. Yeah, so it's a myth. You should totally you should have sex during pregnancy.
It's very safe.
And it is, I think it is good.
It is.
Yeah, it is.
It is.
Sawa. Oh, ni mimi nasema.
Yeah, it's your turn.
Okay. I have so many points. Sijui niseme gani. Okay, what I have is about intermittent fasting and weight loss.
Watu wa kulose weight, kukata kilo. Here's one. Tell us.
So, intermittent fasting and weight loss. I think we can just talk about weight loss generally.
Yeah.
About what did I have? Eating less. There are people who believe when you eat less,
you don't add weight.
You lose weight, and there's something about green teas or herbal teas and weight loss.
Skipping lunch.
That is intermittent fasting. Intermittent fasting basically is when you skip one or two meals.
Okay.
And then maybe you can schedule yourself to have 1 meal in a day, ama you eat a light breakfast and a heavy-ish lunch, and then you skip supper.
Yeah.
Something like that. Yes. So there was a lot about weight loss and all this, and people actually believe. Let me tell you. I just remember. Si kitambo sana actually. There's a patient I saw about a month ago or so. Actually hata nilikuwa nimesahau. So she works anawork kwa ka center hivi, some place she has a ka-M-Pesa in a center. Na it's busy, matatus nini blah blah blah, watu wa smoky nini
everybody.
So she came, I can't remember the complaints that she came with, but her weight presented as an issue for me because she was young. I think she was below 30. And na alikuwa na 100 and or yeah, and something, if not 195 to 100. So I think she just came. Yeah, she just came with pains. I don't know, back pain. I don't know. So, but when we did all tests, obviously they were normal. So I was like, I hope you don't get offended, but I think I have a problem with your weight.
You have to start the sentence like that, otherwise.
Yeah, my friend, people get offended, especially about weight. Yeah. So nikamuuliza is it have you always been like this? Does it run in the family? Ama you have just gained weight recently? Akaniambia, mi hata nimegain weight over the past maybe 1 year and I'm really trying to lose weight. Nikamuuliza, what have you done to lose weight? imagine I rarely eat. Mimi sikulangi breakfast, sikulangi lunch. I think the only meal I eat is supper. Nikamuuliza, so unatokanga kwa nyumba kauza kula and then the whole day unashinda tu unafanya kazi wapi? So she started telling me about now how she skips meals. And then when I asked her more, she was like, nika find out akikaka lunch akisikia njaa sana utasikia ameitisha samosa ameitisha ka sausage hapo. Si unajua wale watu wa street na vitu zao zinakuanga very yeah. So yes, according to her, she has not eaten.
Yeah.
But she has eaten maybe one kasmocha. Unajua smocha? Tama unajua smocha?
Yeah, I know smocha. Who doesn't know smocha?
Rich people don't know smocha. Anyway, so amekula maybe kasmocha na mayai. Ile mayai boilo ile. So amegongewa maybe kamoja ama tuwili. Now that is no, not continuously. Nile maybe morning alifika akasikia kona njaa kidogo akapigiwa mayai mbili akakula. Then maybe lunch time hapo saa 8 akasikia hiyo njaa. Sasa akaitisha maybe ka sausage like that, and then now she eats supper. I told her that is where your problem is. So this is usually what happens. People think that when they skip meals, okay, it actually depends. I've seen intermittent fasting working for people who are very disciplined in the way they eat. Because you can skip a meal and then unapata ile chakula unakuja kukula, you're eating fries. Yeah. Ama sijui chicken and
not healthy
I don't
foods,
know. Yeah,
literally.
Yeah, obviously. But if you keep to healthy food, mostly vegetables, fruits and vitu kama hizo. Alafu now the other thing with intermittent fasting that has I find it a problem is ile njaa unakuanga nayo. Umeskip lunch nakwambia ukiketi
kupatana na the first thing
mpaka mkono mpaka inatetemeka. Nakwambia utakula mpaka utashanga, did I even fast today?
Kwani have you done intermittent fasting?
Actually myself, this is my personal preference. I usually prefer if you're trying to maybe lose weight ama to keep fit, you're better off eating small healthy portions, meals. Yes. You'd rather even snack on fruits or just carry something like njugu karanga, something that instead of skipping meals and then eating one heavy, big and healthy meal.
That is what they don't understand. You have to check your diet as much as unafanya fasting and also exercise, because you can't just lose weight by fasting peke yake. You need to also work on your body.
Weight loss has a lot of
it's just
things.
not one thing. It's like a multidisciplinary thing. Yeah.
We are not weight loss specialists. Tafadhali. We should have a specialist.
We are not, really.
And anyway, I don't think I've never had an issue with
your
weight
and
stuff. So I don't know whether I'm speaking from a point of privilege. But anyway,
healthy foods. Hata kama unafanya hiyo, the way you've just said, small, frequent meals. You said frequent.
I said small, healthy, frequent. I don't know.
As long as healthy iko hapo. Usiende kubinge bana.
Yes. Yes, that is it.
Oh, it's my turn. My point is about family planning. Yes. Hey, this is a very big, diverse topic. But mostly what I want to talk to really
discuss
is about when it comes to religion and family planning, the myth that is between those two. Hiyo mambo hatuja solve mpaka wa leo.
Religion. Okay.
We haven't solved that. Because up to date, I am sure there are women who say they don't practice, they don't choose family planning. And then you come, we know that we need to space our kids, right? And when you ukipata hivi, it is not good for you as a woman, for your health, for your reproductive health, and also for the babies. Even breast milk is not going to be nutritious or going to be of help to your child. Breast milk is very important. Kwa sababu ya kizungu nimeongea hapo.
is allowed. I didn't even notice, by the way.
Karibuni tu.
I didn't notice.
Okay, breast milk ni muhimu kwa sababu ya immunity ya mtoto. Like it starts from uko chini, from when the baby is very young. Okay, no, sasa nime digress. My point is these women say
I actually wanted to ask you what do they say specifically, like what is the myth?
Hiyo ni mambo gani? Mambo ya madaktari. That is a model. It's like unaeka kama unaeka uchafu kwa mwili, like you're committing a sin.
Okay.
Yeah.
Okay.
So do I have to break the nini ama is it?
Break what?
The family planning methods. And
No, you don't have to. Now when we're on that point of family planning and myths about family planning, but I think the practice now is fading out. It was more common with Catholics, and I think they've abandoned it.
Kuna wengine
Imebaki kwa wale watu huko kwetu wewe, wale watu wa
hatutawasema.
Anyway, I don't know whether to tell this story. Maybe I shouldn't. But while we are on that topic of family planning,
yes.
Can we please talk about male family planning?
Equal, by the way, equal.
Yes.
That thing is...
Okay, sasa unajua by the way kuna family planning ya wanaume. Umesikia?
Yes, sijasikia lakini labda unifunze.
Kuna wenye wanatumia pills. Kuna pills zimetoka, hizo ni very recent. Na kuna wenye wanaendanga wanafungwa, inaitwa vasectomy. Sijui kama ushisikia vasectomy.
Hiyo sijasikia.
Sijasikia hiyo? Okay, inaenda wanafunga huku zinaitwa testicles. Yeah, sasa hakuna venye sperms zitafika kwa demu.
Sasa mki have sex haziwezi toka. Na si utagonjeka?
Hapana. Utagonjeka. Na ni reversible kama utake. So okay, tuseme ukiweza ambiwa hiyo ama pills, unaweza tumia, which one is better?
Pills. Family planning. Mi pills kwangu siwezi tumia.
Hawezi? Heri ukafungwe.
Afadhali nitumie pills kuliko kufungwa. Sasa unajua maybe naweza enda nifungwe and then hiyo kitu ilete shida baadaye.
Okay, thing is there. And the way ukuivinja, you remember we did that interview and this guy was like, no, me he said,
oh yeah, we have some small interviews by the tutazieka hapa. Tafadhali note, we are going to we interviewed some few people. We interviewed 2 men about what they believe about male family planning, and you'll see their responses.
The resistance.
By the way, one said,
he even said he'd leave his wife.
Yes, he did. Alisema atatafuta mwingine.
Atikifika ni point ya vasectomy, no.
So apparently I did a small research about male family planning. And I found out basically, apart from okay, obviously there are the common ones about barrier methods like using condoms, there's withdrawal, and then there's vasectomy. And then there are drugs that I think they are still on track. Hazijaingia kwa market vizuri. The kid drug had a very huge name. Niliandika ili, but wajua tu, it has a big name.
Someone thought of the men. Walisema msiende surgery.
Yes. But the research that was done, men don't really want, even when it comes to vasectomy, actually
they don't want it.
They don't. I don't know what it
issue
is
with
men.
What is it? Mnogopa hospitali. What is it? Ebu tell us, by the way. Tuambieni kwa comments. Mbona mnakataa?
By the what icks me, what triggers me is that men always expect we women to do family planning, and I feel like it has a lot of impact in our bodies.
Yes, it does.
Because one, we are expected to carry the pregnancy. when we face fertility issues, and do you know these family planning methods always come with delayed fertility.
Yes, of course.
I don't know what. It's our fault. Na hata hiyo hormones.
Yeah.
Adding weight,
losing,
inakujanga na bleeding. I'm very sure there is no family planning ya men, hata even if they came up with all the drugs in the world, itakuja na bleeding.
Nowhere it's so possible.
Bleeding. It is so bad. Anyway, I mean, please give us a break, men. Tafadhali.
We can't do everything, but
I know we can't. We already anyway.
Hey, we carry the household, and then pia bado they're saying sahizi because they ask what do you bring to hata nimeka vizuri. Wanauliza. Ati what do you bring to the table? So they expect you to be a mother, a wife, and a career woman.
And at that you're taking family planning.
Yeah.
And you're carrying the pregnancy.
Hey, bana.
And you're
bringing
have
life
back pain
to the world. Hey, it is too much.
So please, men who are watching our episodes,
and we are not
tafadhali, give your wives or stroke partners, stroke girlfriends, stroke spouses and side chicks, please give them a break. Give them a break, tafadhali.
But it's something people need to sit down and talk about, even in everything, in every relationship. You know, kama tunataka this certain number of kids na tumefikisha hapo, sasa si basi tu chukwange pills ama na si vasectomy is reversible. It is.
Yes, it is. But not to a small. Okay, the chances of it failing are a bit
high.
Well, I don't know whether we've exhausted that point, but I still want to talk more about it. So, in my very short time of practicing, most of the women who come for family planning, usually they are alone.
Yes. Kuna wengine hata wamenipata wananiambia mimi kwanza there's this one particular woman who came to me. I had walked a journey with her for some time, and then she was like, hey, Mimi, she called me by my name. I prefer telling them to call me by my name. And then she was like, sasa mzee anataka, walikuwa wamekuja clinic ya mtoto. The baby was 14 weeks.
Wow. 3 months.
Yeah. And she's like, Mimi, mzee hata amenipatia pesa, anataka nifanyiwe nini, anataka awekewe sindano, implants.
Okay.
And then she's like, sasa nilikuanga nimeweka lakini sikutaka ajue, sasa tutafanya aje?
Alikuwa nayo already.
Alikuwa amemkataza, alikuwa amemwambia asikimbilie family planning. But sasa, you know, as a woman, kama your instincts are telling you,
and you know,
usifanya hiki kitu ama fanya hiki kitu ama nini, we are usually always right. So me, okay, nilishindwa kumsaidia vizuri, but I told her, you know what, itabidi okay, tulimwambia kaikai na sisi hapo for some time. And then atoke baadaye. Like, but she was like, anaogopa kurudi kwa mzee wake, alafu you know, unajua atanisumbua, tuta argue.
Ulikuwa ushaeka na ukuniambia and all that. I don't know why women will not feel free to actually share with their better halves. Yes. About family planning. It's something I wanted to say na naona nikani nimesahau. What was it?
Before you remember, I think I need to tell them, and I'm gonna face them. You need to create a safe space for your women with everything. If you've decided and you've committed to a certain woman, now may decide this is the one for me. You talk about everything. Create a safe space. Sisi madem huongeanga kuhusu kila kitu with the person who has created a safe space. Wongo, I mean ukweli. I want to say the women to back me up on the comments. That is true. When we feel like I can talk to you about anything, then I'm gonna talk to you about anything. So create a safe space for your women. Hii mambo yote, mara umesikia mtu amesema ati hiyo ni mambo ya bibi, hiyo ni kuosha nguo ni mambo ya bibi, kufua ni mambo ya bibi.
I remembered what I wanted to say. Actually, when you go to a family, ama when you meet a family that has so many kids, whose fault is it? Usually wanasemanga, kwani huyo, I feel like I should say it in Kikuyu. I know. Ekegwire, osho mutumia raciara tabia.
Gayo.
Yani, it's always the fault of the woman. I don't know why it is. Why is it?
They even use worse words than bear.
Hebu sema.
I don't know it, lakini ukiopata hata wakiongea na their fellow men, bana, it's bad.
And if actually even the men blame their women. Kwani wewe uoni wa mama wenzako wanafanya family planning? Why? Anyway,
we should correct that. Look on that men, tafadhali.
Yes, let's take our by the way, family planning is very safe. Please, if you feel like you're not confident, what word should I use? Please, you can always visit the nearby health facility. Let them explain to you about family planning. And by the way, family planning is free in public hospitals. Yeah, family planning is free.
Friendly clinics. You just go to the public hospitals. Uko utasaidika vizuri sana. Ni better.
And by the way, do you know, as men wanakata mambo ya family planning, that is when abortion rates zina increase.
Ziko very high.
And all that, and we can prevent all this just by family planning.
Imagine.
Simple, safe, free.
And girls, stay woke bana. Kama unajua you cannot trust your partner, jipange.
Wacha tuongelele kitu ingine. I think tumeongelelea hiyo sana. But it is a whole video. I know, my God. By the way, we are going to do a video on family planning only. We will. I hope we remember. Please, someone, our followers, remind us one of these days. I'm the next one.
Yes.
All right. Now, I really want to talk about this. I really. This is not necessarily a myth. It is just something I came across. I want to talk about it. It's about male versus female doctors. Now, I don't know what research I was doing, but I came across an article, and it was actually not an article. When I clicked on it, there were so many researches that have been done about male versus female doctors. And this particular article was saying that female doctors are actually better doctors. And it is a whole research, by the way. And not one, there were several.
Studies.
So, yes.
Studies. Sorry. Continue.
Cheza chini, bara. So, apparently, people who are followed up or who are seen by female, they were calling them female physicians, usually have better outcomes. And even surgeons, because in the same article, it said that female surgeons have better outcomes post-surgery. And people who are followed up by females usually have better outcomes. They have longer lifespans. Like if you're a physician or your family Doctor or whoever is a female, usually the outcomes are better, even for the children. Wow. They get sick less. There was just a whole thing. So they were trying to find out what the reason behind this was.
Yes.
And they were saying for surgeons, they were saying that usually females pay close attention when they're doing a surgery. They are more thorough.
Yeah. And
even after the procedure, they usually maybe try to fill in the loopholes.
Yeah.
And then for physicians, they were saying that females tend to spend more time with their patients. Like they sit down, they listen. In most cases, males usually
I wonder why.
Oh my God, watu wataanza kusema hii ni podcast ya feminist.
No, I'm not surprised. I'm not even surprised.
Usually males, it's like they are kind of should I say disinterested?
Are dismissive.
Maybe that's the word.
But don't come for me.
I don't know. No, there's a word I'm looking for. Not disinterest, not dismissive. Mtu mwenye ako tu 50-50. Oh my God, what's the word? Nikikumbuka nitasema. So that is it. Usually how I spend time na patients. Yes. And there's something else I wanted to say na nimesahau. Maybe
I think a woman is all round naturally. So when you're telling her I feel this and this, she's thinking about everything. Unamwambia na feel hivi. Nafikiria hii shida inaweza kweli toka hapa ama or something might have come from, you know. And of course I think they lean more to being empathetic than men.
Actually, now I know why I had to bring up this point. I know why I brought it up in meets. This is because of our society. How many times as a doctor have I been called sister? I mean, when you are in the hospital, people always assume
when is sister.
Yes. And I don't want to call it a myth per se, but people tend to believe that doctors should be males.
Yeah. I mean,
and actually this is a thing. It comes even from females. I remember sometime when I was in college, kuna surgery ilikuwa inafanyika. It was thyroidectomy. So we were waiting for the surgeon. Tulikuwa theater. I think we had waited for quite a while. Na sasa tulikuwa tunashindwa ni surgeon mgani anakuja kufanya. We didn't know. So nikaona tu akanas tu akakuja. She was just small. Amevaa tu scrubs. Amevaa tu scrubs. And then so the runner nurse wa hiyo theater akasema hata daktari amekuja, now we can at least nini. Akasema daktari yako wapi? Akaniambia ndo huyo. Oh my god, when I looked at the lady, she was small, and I actually thought she was a nurse. So I don't know why, but I reacted, hiya, she's the surgeon. I felt so horrible. I felt like it came from me. The my god,
what we have been fed.
What word should I use? Because I think I was just shocked. I was like, she's the surgeon. Kwanza nilikuwa namwangalia hivi zuki alikuwa mfupi kuniliko.
Alikuwa hapo ukifanya hivyo.
I think aliniangalia tu. I was so ashamed. Hata sikuwa nataka kukaa kwa hiyo theater. But anyway, that's what happened, and that is what society has taught us. That doctors will always be males.
Hizo ni kazi za wanaume.
I don't know. I just had to bring it up. So please, just know, your physician should be a female. Tafadhali,
better results.
Anyway, me, I'm a general practitioner, poleni. Yes, even surgeon. And I also thought something about it. I think it also comes with the overconfidence that men have. Do you know that?
Of course.
Men are so... sijui hata niite confidence ama niite ego. Poleni. Yeah, so usually utapata amekuja tu amefanya vitu hapo, and I think because they are used to doing them, ama just because you know people have confidence also in males. Unaamini amekuja tu amekuangalia akakuandikia dawa akakupea.
Oh yeah.
I think but now females kuna hiyo point ya they kind of want to prove a point. They also kind of want to live to the expectation that has been put there by men.
Yeah.
You know, because I'm a female, I can do better than you, because you know kuna tu vitu mingi. So
I also think they're keen to connect with a person. I think connecting with a person and a person feeling that I am safe with this person knowing my problems, I think psychologically it just helps very well to for better outcomes, which we know psychology is a vital part of a person's health.
Yeah. So yeah, female doctors are better. Take that to the bank.
Period.
And we are sorry. Anyway,
period.
Your turn.
Okay, I'm going to talk about over-the-counter drugs.
All right.
So guys, nyinyi ukipata kahoma, kuna mpaka watu wa Wikipedia. Unaenda anaandika symptoms. What do you take when you're feeling like this? Wikipedia.
This point. When you
unakimbia pharmacy.
Ukileta mambo ya kugoogle hapa tutashinda.
No, I'm just saying it as an example. Mr. Kitwanza, tunajua we can talk. We can talk about it sana, lakini but mtoto anagonjeka, umesikia kamelia kidogo, ana run nose kidogo, runny nose, wapi? Pharmacy. Watu wananunua dawa over the counter sana, na they are misusing actually. Unapata a patient comes, hata mwenyewe anakwambia mimi niko na homa, nataka Moxil.
Hi, sasa naitwa Nyambura. Unaitwa?
Naitwa Frederick.
Nataka kukuuliza swali moja tu ya kidogo tu. Ukipata homa huwa unakunywa dawa gani?
Ukipata homa either nikunywa amoxicillin ama ginger, naweza chemsha ginger, ndimu. Hizo kitunguu saumu nikunywe.
Kwa nini amoxicillin?
Juu amoxicillin ndio inapigana na nini ya homa.
Okay. Uendangi hosi?
Homa siendingi hosi. Homa.
Unabai kwa chemist?
Nabai kwa chemistry ama naenda kwa soko na bai ndimu, ginger, kitunguu saumu.
Okay. Na huwa inawaka?
Inawaka kabisa.
Na mtoto? Uko na mtoto?
Hapana.
Uko na bahati.
Yes, the interview we did also, by the way, we asked several people, mtoto wako akigonjeka homa unamnunulia dawa gani? Amoxicillin, wengine sijui
kuna mwenye hata uitisha azithromycin. Amoxicillin haifanyangi.
Na amoxiclav. My God, by the way, people have misused drugs.
Ukimuuliza are you a medical practitioner? Hapana, mtoto wangu amegonjeka sana tangu kwa
na amoxicillin haiwakingi.
Na ni mtoto wa 1 year. Amoxicillin haiwaki. Tupatie azithromycin. Na kwanza they are very adamant. Kama utaki kunitibu, naenda place nyingine.
So this has come with a lot of things, by the way. I think we had another topic about drug resistance and stuff, but maybe we can just touch about it. We can just touch kidogo. So over-the-counter drugs, the culprit here is antibiotics, mostly, especially amoxicillin. By the way, do you know? And painkillers, especially NSAIDs. And do you know now the amoxicillin? My God, I think
it is not working anymore.
What do you think of amoxicillin? Wacha tuulize mwenye ako hapa. Amoxicillin ni dawa ya nini?
Ameshasema tu homa.
I don't know. Amoxicillin, it came from, cause even in the village unapatanga mshosho anaumwa na joints.
By the way,
anaenda anakunywa amoxicillin.
What?
I don't know what people take amoxicillin for. But they, do you know amoxicillin in full is amoxicillin. It's a penicillin. And do you know penicillin was the very first antibiotics that were actually discovered.
Yeah.
And they cater for a lot of infections.
A long list, yeah.
And it has made amoxicillin so resistant. I mean, so many infections resistant to amoxicillin. Nowadays amoxicillin is not even working.
What are you saying?
You know, squeeze me I think hata nikiprescribe amoxicillin naonanga kwanza mtu ameangalia nimemwandikia amoxicillin. Huyo daktari kwani ukwenda shule amoxicillin. Alafu mtu anakuambia basi nilienda hospitali nilipewa tu amoxicillin na paracetamol.
As if that was not a drug.
So over the counter drugs, by the other one is NSAIDs.
Brufen.
Yes, hizo mabrufen.
Sema shosho anakugerera ka brufen.
Na hii ndio imefanya nini increase so much.
Yeah.
Hizi mashida za gastritis. NSAIDs usually
corroding the stomach walls.
Yes, they have that effect. Na zinaleta a lot of gastritis, gas, nizi over the counter drugs. And while we are still on that topic, as we said, in Kenya kila mtu ni daktari. Unajua huyo mtu anauza pale kwa pharmacy anaitangwa daktari.
Tampatia amoxicillin.
Utapata anyway, I don't know.
Lakini watu twendeni hospitali jamani. Unaweza kuwa hata na issue ingine alafu unafikiria tu ni kitu rahisi.
But then unapatanga mtu amepewa so many antibiotics you don't even know where to start.
Siri waambiwe tu there's nothing. What will that cost you, by the way? Na kama itakucost anything at all, that is actually enye utasema wamekuwestia ni time. Kwa sababu kama it's nothing, you have not used any money or no expense at all. Just go to the hospital. People should go for checkups. Kuna kwangana hizi we encourage annual checkups. Just go to the hospital, get checked and then go home. It will cost you nothing.
And especially for kids. Actually unapatanga mtoto wa less than 6 months amepewa cough syrup.
Unashangaa
na the cough syrup clearly cough syrup yenyewe imeandikwa ask for real kwanza imeandikwa vizuri for children aged 2 years and above, lakini mtu alichukua tu
akakuzia kwa sababu you know this person is in business. I don't care about your health, I don't care about your child.
Even Piriton is not allowed for infants.
It is not allowed.
It's not even safe. So unapatanga mtoto amepewa hiyo, amekuja sasa coffee imeshikana kifua. You are like my god.
We even put them on oxygen kwa sababu no imekuwa mbaya.
Over the counter medications kindly.
It's a no.
It's a no.
X.
Yes. Okay, let me see which one we should talk about. So I think we can, while we're still on that topic, because I had another topic about tonsillitis and antibiotics, flu and common colds and antibiotics. Since we are already on that topic, about vile mtu akikuja na homa ama alete mtoto ako na fever nini kwa hospitali, and you don't give them antibiotics, they always feel like you've not treated them.
Unatupea nini daktari?
Especially tonsillitis, by the way. So usually watoto wanakuja huko tonsils maybe zimefura
mbaya tu
nini not mbaya per se, but maybe to tonsils tumefura ama maybe akona ana feel pain on swallowing nini, and then when you do the blood test there's no infection, so unampea just something for fever and for pain, and you know, then you tell them drink a lot of water to pay antibiotics. So and even flu and antibiotics. And then there are people who believe that once your mucus turns green, it's usually a sign of infection. It is not. And tonsillitis usually is a viral infection. Usually, commonly it's actually a viral infection unless there is superimposed bacterial infection, and that one will come with other signs like pus. You can actually see pus in tonsils, but basically it's usually a viral infection. And for a viral even most flus and common colds and all that, usually they are viral infections.
That's why lazima they recur.
And viral infections usually they are self-limiting. You don't need antibiotics for that. You don't. All right.
Yeah, because antibiotics basically are antibacterials. They are for the bacteria.
Yes. We've been talking for like 30 minutes. And I didn't expect that, by the way. When we were shooting this episode, tulikuwa tunaulizana na Tama, my god, will we have points?
Tutakuwa na content.
I know.
Tutakuwa na words.
It's a shock. Anyway, so this episode inakaa imekuwa mrefu sana bana. I think we will have to do it at a later date. So please watch out
for part 2
of Medical Myths Unlocked. Yes,
it's gonna be interesting as this one.
Epic. Subscribe, guys. Imagine after this content vile tumejitolea, we have been mpaka nasikia mdomo imekuwa dry. We have been talking,
tumeongea bana
for all those minutes. Alafu imagine kuna mtu tu ana watch, imagine na just subscribe. Someone is, and I know you who has been telling me nice work and you've not subscribed, please. But for the people who have subscribed, thank you so much. Please comment on the medical myths that you know, not necessarily medical myths, but even the beliefs that are there in your village, in your culture, in your family, everywhere. Tell us. We in every episode we will be previewing our comments. For now, obviously we will be previewing all comments. We will be taking the interesting ones.
We need to know what you think.
Yes, so that it can be an interactive session. But please, people, subscribe and share
and like and hit the notification button.
Please. Yes, we are going to bring hot topics.
Yes.
Thank you.
Bye.
Wueh.